This show is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice. The content on this show is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they have, and they should seek the assistance of their healthcare professionals for any such condition.
This is Rooted in Healing with Dr. Beth Claxton, exploring the science of functional medicine and the power of healing from within. Breathe in, breathe out. And now your host, Dr. Beth Claxton.
Hello and welcome to another episode of Rooted in Healing. I'm really glad that you're here today. I wanted to have this episode about demystifying traditional Chinese medicine. I think it's something that gets thrown around a lot, Chinese medicine, acupuncture, and I know for me, I really didn't understand it. And even after I had my first several traditional Chinese medicine treatments, I still didn't completely understand it. And I think that it is honestly something that takes a lifetime to really understand, and maybe even requires living in the culture of China and the Eastern cultures to really deeply understand it as a Western person. The guest that we have today is named Milissa Gillen, and she is a traditional Chinese medicine practitioner who, from a relatively young age, aligned with the whole vision of TCM, is what we call it. She has always been very connected to nature, and when she learned about Chinese medicine, she actually just immediately fell in love with the process and knew that this was her path. So such a natural, beautiful process that she went through as she became certified. And she still is one of those people who continually thirsts for more information and sees the beauty and the connections between the practice of Chinese medicine, the beliefs, the spirituality, the herbs, and the culture that is brought into it, the Chinese culture, and even the language that connects it all together. So talking with her and preparing for this interview has been all a process of really appreciating the depth of Chinese medicine. For my story, I mention it in the interview. I didn't really know much about Chinese medicine at all, and someone recommended it for me because I had a running injury that had been going on for probably about a decade, and I hadn't been able to run for very far at all without getting pretty significant pain in my IT band and in my knee and in my hip. And I had been to a podiatrist, and I had received a cortisone injection, which really did nothing. And not until I saw a Chinese medicine practitioner that they did an evaluation and told me that they didn't really think that the problem was in my knee. It was in my liver, which threw me completely for a loop. Like, as a traditional Western medicine trained practitioner, and I was just fresh out of residency when this whole process started of my Chinese medicine experience, I was really baffled. Like, I still, like, even now, I just, like, there weren't any words. Like, okay, like, what in the world do you mean? And knowing that there was no easy explanation for how this all went together. And I went along with the treatment knowing that there was something true. There was some resonance of truth in that statement, even though it didn't make sense to me at all. And the next day I was able to go running for about 2 hours, and I had not run like that in a decade or more. That brings me back to this interview. I've now partnered with Chinese medicine providers in my practice, and I recommend Chinese medicine for certain conditions. They tend to work Chinese medicine has a really nice approach for hormonal balance. It can be really helpful in gut health, emotional health, and then anything that affects the immune system. And as we know, everything's connected to everything. We're all in there with the soup. So whatever we can do to affect that system is helped by Chinese medicine. And Milissa is going to expound on these theories and hopefully give us all a better understanding of what this mystical Chinese medicine is, where they stick needles in and things happen and people get well and feel better. It's all fascinating and really supports the fact that we don't know everything in medicine, in this Western medicine model. There are so many other ways to heal, and this is just one of the many. So with that, we're going to go to this station break, and then we'll be back to interview Milissa. I'm excited to see them.
And now, more Rooted in Healing with Dr. Beth Claxton.
Welcome back to Rooted in Healing. I'm Dr. Beth Claxton, and we have with us today Milissa Gillen. Milissa is a licensed acupuncturist and masters of acupuncture and oriental medicine, and she holds a master's of acupuncture and oriental medicine from the New England School of Acupuncture. She is certified by the National Certification Commission for Acupuncture and Oriental Medicine since 2003. And Melissa's studies included both Chinese and Japanese styles of acupuncture and Chinese herbal medicine. And she worked as an assistant instructor at her school for 4 years after graduation, which is an honor. It means you're a really good student when you get invited to stay and teach, while continuing to study with 3 different acupuncture masters. She focusing on meridian-style acupuncture. And Milissa also holds postgraduate certifications in advanced Japanese acupuncture, Shaikuju therapy, auricular acupuncture, which means the ear, and balance method acupuncture. She holds a license in California as well as Arizona as an acupuncturist. And Milissa has poured her focus into learning and practicing balance method of acupuncture with the late Grandmaster, Dr. Richard Teifu-Tan. And today, Melissa's treatment modality primarily focuses on balance method acupuncture, which is known around the world for its clinical efficacy, especially when it comes to pain management. Her treatment approach also includes Japanese meridian-style acupuncture and Japanese-style moxibustion therapy, which is also known as Okyu. And moxibustion, if people don't know, it's a bundle of herbs that you burn almost like incense, but you burn it at, like, you hold it near certain acupuncture points for a similar but more gentle type of activation of those points. Melissa's goal as a practitioner of oriental medicine is to assist and support people in their journey to optimize their health in mind, body, and spirit, achieving their best quality of life and best self. Welcome, Milissa.
Oh, thank you, Beth.
You're welcome. I'm so glad you could join us. And I wanted to bring you on because, as we spoke the other day, Chinese medicine, I know for me, before I started exploring it, it seemed so mysterious and like maybe it didn't belong here. It belonged on another continent. And I didn't really understand it. And the first time I went to an appointment, I remember I had been having problems with my iliotibial band all the way down the right side of my lateral thigh. And I remember the she was an acupressure Chinese medicine person. She said, I don't think that the problem is actually in your leg. I think it's in your liver. And and it kind of blew me away. I was like, what? And I said, well, she said, but I think I can help you. And I said, okay, well, whatever. Yeah. And the next day I was able to run for about 2 hours, and I hadn't been able to run for years.
Oh, wow.
Yeah. So it really moved whatever it was supposed to move. And I felt great. And I became a believer, and I started really diving in with curiosity into how this works and what's going on. So I'd love to hear your story about how you were interested in Chinese medicine.
Oh, sure. And I'm so glad to hear that you had such great results right away.
Yeah.
That's fantastic.
Yeah.
So I got into Chinese medicine at a very early age. I was doing some research for a writing class when I was in college, undergraduate school, freshman, and I came across a book about Chinese medicine. It's called Between Heaven and Earth. And I just loved everything that was in that book. It made complete sense to me. And I would say the biggest takeaway from that I remember was that they compared the physician as a gardener versus, like a Western physician that is like more like a mechanic. Mm-hmm. So they were saying the Chinese medicine physician really like tends to the body and treats the body like a garden. And at that time, I was very interested in spending time in nature and learning about plants. And I was curious about using plants as medicine. And so then I found out that the Chinese medicine had an entire pharmacopoeia of herbs that they use for healing. Mm. And so I was pretty much sold on it after I read that book. Of course, I did a lot more research on it. And then I happened to also come across a practitioner, and I was able to get some treatments for myself. Mm-hmm. So I was getting treatments for really severe menstrual cramps and problems that I was having at the time. And because this acupuncturist was a friend of a friend, she actually taught me how to needle myself. Mm-hmm. So I started needling myself when I was about 19. And so, that all just sort of happened around age 19 or 20. And so I just really fell in love with it and decided that that's what I wanted to study and do.
That's a beautiful story. Like that's truly following like divine guidance and intuition.
Yeah, thank you.
Finding a book and reading the book. Oh, okay. Thank you. That's it. And here I go.
It just made so much sense. It felt like, well, this is how I already think. So I don't know. It just resonated so deeply with me. And I'm glad that I had, I guess, the courage at the time to just step into that. And I had a very supportive family that said, sure, go for it.
Oh, that's nice.
So that was great. Mm-hmm.
Very helpful. And you are very much an outdoor person. You do these very extensive endurance races. Tell us a little bit about your sleeping on the ground and spending time in nature.
Mm-hmm. Sure. I did grow up riding horses and spending time outside with my mom. And when I went to college, I got into backpacking. So that kind of right around that same time, actually, I would say. Mm-hmm. Freshman, sophomore year in college, I got into backpacking, and I absolutely fell in love with that too. And over the years, actually more recent years, in the past 10 years, I started getting into long distance backpacking. So hiking like the Pacific Crest Trail, things like that. Mm-hmm. When you start out on a journey like that, you're committing to 6 months of walking and sleeping on the ground. It changes your life and for the better. And so that sort of segued into trail running and ultra distance trail running. And I think the bottom line for me is that it's absolutely a spiritual path, and it's just a way that I can go out and spend time in nature and connect my soul and rejuvenate myself. And I really try to choose beautiful places that really just inspire me to go and visit these places and do these things.
And how do these events or these times in nature, how do they inform or balance your career in acupuncture?
Oh, I love that question. That's so great. I think those times that I spend out there help me be my most pure and authentic self. So I feel so good and so clear and so grounded and just happy and joyful. And I think part of my life path is to express joy. And so I feel like when I can come back, I share all that energy with my clients and I give it to them. I just, it's running through me and their chi is moving and I'm helping them with their chi. And so there's just a natural extension of energy, I think, that gets sort of gifted to other people that I bring back with me after doing things like that.
Oh, that's a beautiful message. Yes. And you're a very clear, vibrant person. So it's like you're bringing the energy of the Pacific Coast Trail trees and the views back into the office with you. That's so
I hope I am.
I think you are. I'd have to say,
yeah.
Knowing you, yes.
Thank you.
You're welcome. So let's talk about the philosophy behind Chinese medicine. I love the garden analogy. What if you can explain so that people can start to wrap their heads around what is this acupuncture thing that, needles and sometimes, not often do practitioners do those teas that don't taste very good. But what is it? What's the philosophy behind all of that?
So the philosophy, there's the basic, most important one is the theory of yin and yang balance. And a lot of people say yin yang, and in Chinese the word is pronounced yang. And also the symbol of the Tai Chi, which is the yin yang symbol with the black and white and the half circles with a little dot on either side. So that's the symbol of the yin yang in perfect harmony and perfect balance. So what the most original thought in Chinese philosophy was really based on observations of nature and observations of the earth and the seasons changing and the cycles and the day and night and the stars and the moon and the sun and all these things. And so they took all these observations and they started applying a theoretical framework that's actually quite mathematical, which we won't get into, but it's very mathematical and it's very poetic. But what they're essentially doing is looking at the human body when it comes to their philosophy as it applies to our health and our well-being and our illness, is they're taking like a macrocosm, microcosm perspective. So they're looking at the earth and the seasons and the changes and the elements, all the 5 elements of fire, earth, metal, water, and wood. And they apply all of those concepts to the human body as if, we are our own earths ourselves. And that's what resonated with me so much when I read that book, because I just thought, what a beautiful perspective. And then that's how it informs the idea of treating the body like a garden. It's something you tend to. So when yin and yang get out of balance, or when your chi gets stuck, like what you described about with your leg, that is where the practitioner is trained to come in and get everything back in harmony so that it's all, even and smooth and flowing and equal, so that you can feel your best and so that your body can heal itself.
Yeah, so we're all like little holograms of the earth.
Yeah. So like the ear, like you said earlier, auricular acupuncture is ear acupuncture, and the whole entire human body is mapped out on the ear. And if you were to look at a diagram, it would be an upside down fetus. So, for example, the earlobe is the head and the brain and the face. Mm-hmm. So there's hundreds of acupoints just in the ear itself, and some people, that's what they specialize in. So that holographic mapping can happen anywhere on the body. You can do it on, there's head points, there's abdominal points, there's points on the hands, the feet, and then also some people even say that you can use Chinese herbs holographically as well. So meaning that a specific plant would have a holographic equivalent to a certain acupoint on the body. Mm. So you can kind of think about it that way, which I think is really fun.
Yeah.
Mm-hmm.
Yeah, and so much science and so much mathematics and precision. It sounds like
when you really dive into the Chinese philosophy, it's incredibly mathematical mm-hmm. and incredibly precise. So that gets it gets quite complex, but then there's always this common thread of like this beautiful simplicity throughout. That's just super fun to learn about.
And even the Chinese words, as we were talking about a few weeks ago, sometimes the words and the descriptions are quite beautiful, and we don't even have descriptors like that in the English language, right? Mm-hmm. Mm-hmm. Yeah.
Yeah.
So can you talk a little bit more about qi? Like, what is that? What does the word qi mean to you? How can you describe it for our listeners?
So qi, and other people might have also heard the term ki, mm-hmm. is similar to also the word prana in yoga, mm-hmm. but basically it's energy, and it is what animates life. So the qi in our bodies is everything about us is qi. So it's the animating life force energy. Our qi, our individual personal qi, when we're talking about, our health, is that we're born with a certain constitution, and then based on that constitution, that qi combines with the air we breathe and the food we eat, and all of that together sort of defines like our overall baseline health. Other people have described qi, when I was in school, they told us that it was energy on the verge of becoming matter. Mm. So you get a little bit into physics with that when you start talking about that kind of stuff. Mm-hmm. However, it also doesn't mean that there's no qi in inanimate objects. For example, because the earth has qi, right? And so if you feel a rock or something like that, mm-hmm. It's not without qi. It's still there.
Right.
It's just not as animated as something that moves and blinks, and like an animal or a human or something like that. But essentially, it flows through our bodies, and it flows through the different meridians, which we'll probably talk about in a little while. And when the qi is balanced, that means we are healthy. And when the qi is stuck or out of balance, that's what causes disease.
I'm thinking about how different this is, how comprehensive and deep and, really full spectrum this is. Mm-hmm. This concept of health is, compared to walking into someone's office for 5 minutes and getting a pill and leaving.
Yeah, absolutely. And that, brings me to the point that we were talking about recently was, when you walk into an acupuncture office to go get a treatment, or when I see a patient, I always know that we are working in multiple dimensions of mind, body, spirit. Mm-hmm. So when we're working with a person's qi, it's not just your leg that hurts. There's so much more to it. And it doesn't necessarily have to be talked about even, but when you're getting acupuncture treatment, it is all of those things. And I love that it's that.
Mm-hmm. That's a full garden.
Mm-hmm, exactly.
Taking care of the garden. So how is it that acupuncture actually works?
So there's a lot of different ways to describe this, mm-hmm. and sometimes people want a more like technical scientific answer. And what I will say to that is it really, really boils down to physics. in terms of how to explain that on a scientific level. However, there are some, terms out there that people will say that, like it affects the central nervous system, reduces inflammation. It's working like, as a metaphor, I'll say like a grid switchboard in your body. So like an electrical switchboard. And there's all these channels that run through, and you stick the needles in and it activates a certain area, which will activate a part of your brain, which will then send, feedback down to other parts of your body. It's a lot, it has a lot to do, and I don't know if listeners will be familiar with fascia. But fascia is essentially like a giant webbing system that runs all over our entire body, and it wraps around everything, including our organs, but it exists between the skin and muscle layer. And the fascia is sort of what we're aiming for. It's not to be honest, it's not a term that I learned in acupuncture school. I think fascia has become more popular recently in terms of something that people are talking about. But it does not have, any of its own like blood vessels or anything like that. You're not trying to hit any nerves when you stick a needle in at an acupoint, but the fascia itself does have its own electrical system. And that would probably be the most equivalent way to say that we're activating the chi in that area. Yeah. Because we can put a needle on your ankle and it'll fix your shoulder. So how does that work?
As I understand it, like the fascia has a lot of electricity, and it connects through water molecules to the tissues. Like that energy is carried in the water molecules that interface the fascia to the muscles, the nerves. And I describe fascia to patients because it's a layer that we go through when we do surgery as a surgeon. And it looks like Tyvek.
Yeah, that's a great one.
So when you look at Tyvek, a sheet of Tyvek, it's like a bunch of little plastic, it's a webbing, a super tight webbing of plastic, and you can't really bend it or stretch it, but it's super strong, and it makes a really nice barrier and protective covering, and that's like fascia in my book. So with fascia, if you talk to somebody who, for example, specializes in myofascial massage, and you look at the textbook that they studied to learn what they do, you see all these myofascial meridians. And if you compare those to the acupuncture diagrams of their meridians, they are so similar. And so it's super interesting. I don't know if they did dissections in ancient China and looked at bodies, but I think they did. I think they did.
So they very well could have been looking at the fascia and studying how it communicated to different parts of the body. Because what fascinates me, and this is very specific also to balance method acupuncture, is using distal treatment points. So like I mentioned, a point in your ankle that'll fix your shoulder on the opposite side of your body, no less. So, and it works instantaneously, like within seconds you have pain relief. So that's because of the fascia.
So why would you work, I'm just going to ask a question, that because people have probably gone to a physical therapist and had dry needling where they put the needle in the area that is hurting.
Yeah.
Why? Can you explain the difference between that and doing like the opposite ankle for the opposite shoulder?
So you can, and just to clarify too, that doing the opposite side of the body or in a distal body part, that is specific to balance method, and they don't teach that in acupuncture school. So that's just something that I learned. It's something that I do. In school, they will teach you, if you have shoulder pain, you needle in the shoulder, and then you also needle other points around the body that are considered your constitutional imbalances. So like your acupuncturist that you went to saying, oh, it's coming from your liver.
Right.
So she probably needled some points to work with your liver.
Yeah.
In addition to working with your IT band. So what the physical therapists are doing with dry needling, it's a different technique. They don't typically retain the needles. It's more just of a temporary manipulation of the tissue in the area. And it does bring, chi and blood and circulation to the area. And, I've heard mixed reviews on people, getting good results or not getting good results with it. So just, there's choices essentially, and different acupuncturists are going to use different techniques. So I just want to be clear that if you go to somebody and you have a shoulder problem and they stick a needle in your shoulder, there's nothing wrong with that.
Yeah, right.
I just do it differently, and I do it that way because I get really good results with it.
Yeah.
Yeah.
That's great. That's great. There are lots of different ways to do it, and however the practitioner feels the most comfortable is probably the best way for that practitioner to be treating. Yeah.
I do, because I've had people come in and say, well, I used to go to this person and these are the points that they did, and they'd hand me like a piece of paper and so then I have to decide, well, what is this person? Does this person just really want me to repeat what they had before, or do they want me to use my skills? And usually it's a combination of both.
Yeah. Good.
Yeah.
So, okay, here's the big question. Is acupuncture painful? Because you're using needles and you're sticking them in my skin.
Right.
And it's usually at the places that don't feel good.
Exactly. And so I would say that so many people just automatically assume that it's painful, or they say, this is what I hear most, is, oh, I hate needles. And I've been trying to convince people, and it's not until you actually try it, because there's no way to describe what it feels like until you've had it done. It really is not painful, but you're going to get sensations where the needle goes in. One of the reasons I do the balance method is because I don't have to stick a needle where you already have pain. I leave it alone. And then I actually ask people to move the area and activate the area once I put those needles somewhere else, and they feel better. And they can be like, oh my gosh, it feels better. Wow. But the sensations will be interesting because everyone's different. I definitely see a spectrum of people who are extremely sensitive to people who literally feel nothing. And then in between, there's things like maybe tingling or warmth or like a really brief twitch that might happen. Those are all just what we call like a chi sensation. Like almost like an electrical impulse. Sometimes after the needles have been in it for a few minutes, it might start to feel heavy or like a pressure or like an ache. But it doesn't always feel that way. It's just something that can happen and that is common. So I always just tell people, whatever you feel is, it's okay. The only thing I don't want people to feel is anything like burning or sharp or pinchy. And in that case, what actually happens is the fascia, because it's responding, it will twist around the needle and kind of tighten. And so if that's happening, I can literally see it in the body, and I'll just adjust the needle a little bit and it'll release, and then it's fine.
That's so interesting. And the other thing I've noticed when I've had acupuncture is sometimes, like initially, the needle goes in and it's a little agitating, and usually by the time I leave, I'm deeply relaxed. So what's happening there? So when the chi starts responding to the stimulus of the needles, it activates your entire nervous system. And so you go into the rest and relax state, as opposed to the typical fight or flight that we're almost always in. And some people say it's similar to going into like a delta wave, or almost like a meditation, or that space between being awake and asleep. So it's definitely very euphoric feeling, I think, for a lot of people. A lot of people fall asleep during their treatment. I would say 8 out of 10 people that I treat usually take a nap while they're on
treatment table. So even if they did, like you said, experience some sensations when the needles go in, that sensation usually doesn't last. And once it abates, it's very sedating, and people just find it incredibly relaxing. And then of course we've got heated tables and usually like a foot warmer. We've got calming music going on.
So
There's
nice.
all the things too that also just enhance the space to make it more conducive to relaxation, because one of the most important things about acupuncture treatment is we're treating stress, and stress is one of the biggest aggravators of any ailment that we have.
Yeah, I would agree. I want to ask one other very detailed question. How deep do the needles go in?
So I like that question. That's great, because they're really varied. And so, for example, when I learned the Japanese style acupuncture, and I know you mentioned it from the intro, the shakuju needles, they don't even ever penetrate the skin.
Wow.
So that's a completely different style, and you use one single needle, and the practitioner's just touching it to certain points. And then the insertion needles, the Japanese style, go in just about anywhere from 1 to 3 millimeters only. Chinese style needles are aiming deeper. So I would actually say that the Japanese style needles are not touching the fascia, which is pretty interesting. The Chinese style needles are touching the fascia. And then, for example, if you need a needle into the glute muscle, one of our biggest muscles in our body, to get deep enough in there to a point where you're going to reach the chi, you need longer needles. And that depends on the size of the person and all of that. So we do have some long needles. I use them on occasion, but on average, I would say they go in probably like a few millimeters to a quarter of an inch.
Okay.
Yeah.
Okay. And you wouldn't be seeing the glute needles going in anyway? So it doesn't matter that much.
No, I mean, I don't show those needles to my patients, because if they saw them, they'd probably freak out a little bit. They're probably like 7 inches long, some of them.
Oh my gosh.
But it's a but, you got to go through fat layers.
Yeah, exactly.
Or if you want to needle the abdomen, for example, I don't do many abdominal and glute points. I do them once in a while. A lot of practitioners do like to do those abdominal points. And if somebody does happen to have a more fatty body, if you just needle into fat, nothing's going to happen. Like you don't, or I shouldn't say nothing, but it's not the same. You don't get the same chi response.
Right.
So if I do, want to get on a deeper level, I'll have to use a longer needle on somebody.
Yeah. So
yeah, it just depends on the body part.
Yeah. What kind of conditions would someone go to Chinese medicine for acupuncture?
I mentioned stress, and I'll just say that again because I really see it so much, and I'm sure you do
it's
too.
Everywhere, right?
Everybody knows. It's no secret. We just live in a stressful world, and it is just such an aggravator for everything else that we have going on. And if you can only work with that, you're still going to benefit, and you're still going to get past some of the ailments that you're having. That being said, acupuncture technically can treat anything because it is working with the energy. And so the energy exists before the physical condition exists. So whatever's going on at the root of that energetic imbalance is what we're treating. And then we're activating the body to stimulate its own healing mechanism. We have that innate intelligence within us. And so we're helping to stimulate that. And the body can self-correct. And you see it in animals all the time out in the wild. So there's that answer, but then there's also, clinically speaking, I definitely treat anything from, like hormone imbalance type stuff, like women who have premenstrual syndrome, menstrual cramps, any kind of gynecological problems, allergies, fatigue, digestive issues, IBS, headaches, migraines, physical pain I treat all the time. Low back pain is probably the most common thing I treat all the time, sciatica. And then I also just want to mention too, because your listeners might not know about this, but in addition to treating stress, acupuncture works so great for mental health. So working with that more spiritual component, people come in, and when I look over everybody's intake form, my new patients, there's a form that, part of the form that talks about your stress level, and people will check like 8 out of 10, 9 out of 10, and then there's a checkbox underneath, and it's just like, panic attacks, anxiety, depression, all these things. And I have worked with a lot of patients with PTSD. So that population has told me that specifically the acupuncture helps so much with their mental health.
Yeah. And addiction as well, right? And smoking cessation.
Oh, yeah, absolutely. Yeah. I just had a guy come in yesterday. It was only his second treatment, and he's been coming in once a month, and which is not that frequent when you start. And he said, whatever you're doing, it's working. He's like, I went from smoking 2 packs a day, I'm down to 10 cigarettes. Wow. And he didn't even come into me for smoking cessation. That wasn't even the reason he came in.
That's beautiful.
He was so excited about it.
Yeah.
So this is what we call an acupuncture side effect of these, these hidden benefits. Like, I came in for my shoulder pain, but I'm sleeping so much better. Things like that. And that happens all the time.
Or back pain, and I stopped smoking. And how many treatments would someone need?
So we have a few ways of looking at that. I always like to tell people at the beginning to not wait too long between their first, second, third, and fourth treatment. So if they can come in once a week for a month, that'll take care of any, I would say, issues that aren't super chronic or long-standing. And it's also just sort of gives you some time to get to know somebody and see how they respond and see how they feel. And then if you do want to prescribe herbs, that's a little bit a deeper level journey. So I usually tell people to come in once a week for 4 treatments. And then if it's more of a chronic condition, then I'll say, well, probably 8 treatments, and then continue to reevaluate from there. People with extremely long-standing, like chronic conditions, let's say 20 years or something, they're probably going to more be at like a maintenance level where they're probably going to need acupuncture for a long time, probably many years, and just come in periodically and work on it. And that might, that condition might not completely resolve. But somebody who comes in within a more of an acute situation that is fixable, you want to stack the treatments closer together at the beginning so that you can actually, complete and resolve the treatment and move on, to the next thing.
Yeah. So if someone's coming in for treatments, how do I want to phrase this? Like, what can they do to help make those treatments work better? Would you give them Chinese herbs, or can they make lifestyle changes? Do you counsel people with this, on this?
Both. I definitely, we do like for people to come in well hydrated and having eaten some food at some point in the last few hours before their treatment. And that's just on a, for each and every treatment, that is something that does help you get better results. And then in the bigger picture, I definitely have seen people who are generally have healthier lifestyles. Now, this is a generalization. It's not an absolute, but people who do pay more attention to their health, eating a certain way, really just eating more of a whole foods diet, just people who exercise, people who drink plenty of water, don't abuse alcohol or drugs or smoke, things like that, they just tend to respond a lot better. And then what we do is in their initial treatment, we do ask a lot of questions and we do a diagnosis. And if we see areas of, lifestyle factors, and this would probably be especially with diet, because in Chinese medicine, we are very big on food energetics. And food is medicine and medicine is food. That's very ingrained in the Chinese culture, and it's ingrained in the medicine. So herbs aside, food is medicine. And so if we see something in there, we're definitely going to take steps to provide like educational materials and just some basic coaching to help people maybe shift things up a little bit that we think will be beneficial. And then it's beneficial for their whole entire life. And then it also will help enhance the efficacy of their acupuncture treatments.
This is such a great, go ahead.
Yeah, go ahead. I was going to talk about Chinese herbs.
Yeah, we're almost at time. So
yeah, okay.
Yeah. So I think that this has just been so great, an introductory interview to Chinese medicine, so that to demystify for people what it is, what it does, when someone would want to go see a Chinese medicine provider, you know, how much it's going to cost, those kind of things, how often they would be expected to go. And you have an offer for our listeners. And I, first of all, would like to know where they can find you. Tell us where you work.
So I work at Harmonizing Healthcare, and we're on North Rose Street in Flagstaff in the right off of 4th Street. Okay.
And then you have a gift offer for our listeners as well.
Yeah. So we just wanted to extend an invitation to, if any of your listeners are interested in trying acupuncture, our initial visit is a consultation and treatment. So it's usually about an hour and a half to 2 hours. And we're just offering a 10% discount on that initial visit. And that would be through the end of this year.
That's so gracious. Thank you. Thank you.
Oh,
for
you're
doing
welcome.
That. Yeah, that's great. And is there anything you'd like to add before we wrap up?
I would say that, you know, if anybody's listening and they've had a curiosity about trying acupuncture after listening to our conversation, just come and try it, because like I was saying earlier, there's no really great words to describe how great it feels. But I know, like, I just had a treatment last week from one of my colleagues, and it had been a while, admittedly, and I was just like laying on the treatment table going, this feels so good. And you just feel balanced in, you know, mind, body, spirit. You feel completely like it's a reset. So, you know, even if that's all it is, or that's all you're coming in for, that's okay. You don't have to be sick to come in and get acupuncture. Yeah,
we all need it right now, right?
Yeah. It just makes everything better.
Acupuncture makes everything better. Well, thank you so much for joining us. Thanks for your time today.
Oh, well, you're so welcome. Thanks for inviting me to be on your show. It's been really fun talking with you.
Oh, you're welcome. And we'll be right back after this message.
And now, more Rooted in Healing with Dr. Beth Claxton.
Hi, thanks for coming back. We've had a great interview today with Milissa Gillen, who's a licensed acupuncturist and masters of acupuncture and oriental medicine in Flagstaff, Arizona. And she came to us today to demystify traditional Chinese medicine and acupuncture, because so many times I've heard people say, oh, I got dry needled, or, you know, thinking it's the same kind of thing, or I'm afraid of needles, so I'm not going to do that. And I wanted to lay it all out on the table and try to educate so that we can make an informed decision about what's right for us and what would be a good thing for our health, and as we decide to put together the pieces of our own healing journey. So Milissa had some really great insights, and she's such a beautiful soul who has lived and breathed this nature path, and she refers to Chinese medicine as tending the garden. and the garden is the health of an individual, and the practitioner tends to it. So such a beautiful and gentle way of going about taking care of humans. And her practice offers a great discount through the end of the year. Please make sure that you take advantage of that, which is 10% off an initial consultation and treatment, which is about 1.5 to 2 hours. You can find her at harmonizinghealthcare.com. And when you call the office, you just mention the show, that's where you learned about Milissa and acupuncture, and they can extend the discount to you through the end of 2025. And as far as my practice, I am always available, BethClaxtonMD.com. If you'd like to learn more about functional medicine, other modalities of healing, just come on. You can register as a new patient. You can book a connection call. You can send us an email or call with any questions. And I thank you for being here and staying on till the end. And this is Rooted in Healing. We're on Saturdays at 9 a.m., 106.5 FM, 780 AM, KAZM, Mellow Mountain Radio in Sedona, Arizona. And I always ask people to find that thing, that whatever it is that brings you joy and happiness, because that's going to impact your health more than you realize. So go do that.